Does my kid have bipolar disorder? This is a parent's guide to figuring out whether your kid has bipolar disorder and what you should do about it. I'm Dr. Josef Witt-Doerring. I'm a psychiatrist. I used to work at the FDA and I've worked on a number of pharmaceutical companies, and I help people make informed decisions when it comes to psychiatric medications. Understanding whether your child has bipolar disorder is really important, and here's why. The mainstay of treatment for bipolar disorder is typically medications, and a lot of these medications have a lot of risks associated with them. If we're looking at drugs like lithium, we're talking about renal damage and thyroid disease. If you're looking at drugs like Depakote, you're talking about liver damage potentially over time. And if you're looking at the atypical antipsychotics, which are frequently used in bipolar disorder, now we're talking about heavy weight gain and potentially a movement disorder called tardive dyskinesia. So this is a condition that typically leads to 3 pretty dangerous medications. So if your child is going to be diagnosed with bipolar disorder and they're going to be exposed to these potential medications, you really want to make sure that you have the diagnosis right. Let's talk firstly about what is bipolar disorder. A lot of people don't know. Classically, bipolar disorder was explained, was thought to be these moments of really intense euphoria and grandiosity where people would think they'd have superpowers and they would be very disinhibited. This is a classic mania that's been really common throughout time. It's frequently described in books. But what we actually found in the last 50 years or so is that there's been the advent of more of a spreading of different kinds of bipolar disorder. So things such as mixed mania, which describes more of this agitated state of bipolar disorder. And so it's kind of creeping further and further away from this general idea. And a lot of critics are saying that the boundaries around what bipolar disorder is actually broadening to encompass a lot of things. Now, why might this be important? Well, it's important because as you step more away from these very easily recognized kind of manic episodes with a lot of euphoria and grandiosity, and they really look very clear, if you broaden that to more of these irritable states, you can have a lot of misdiagnoses because a lot of things cause irritability and disinhibition. And we're going to talk about some of those things really soon. The next thing I want to say is that bipolar disorder is typically something that happens in your 20s. It was previously thought that it was very rare that anyone would actually have a bipolar type episode below age 20. But then there was a lot more talk about juvenile bipolar disorder, and this has been heavily criticized by a lot of people because they just think that there's not, even though there was a lot of push to talk about this type of bipolar disorder, a lot of people ended up thinking that there was a lot of risk in actually giving young children this diagnosis because of the risks of the drugs. Juvenile bipolar disorder is a very controversial diagnosis, and you would want to think very carefully about it if someone is giving your child that diagnosis. So the next thing is, if your child is having a lot of problems and your doctor is saying that maybe that's bipolar disorder, we need to think about what the other things could be that might be making them look like that. And so when it comes to bipolar disorder in kids, I'm going to think about one main thing: adverse reactions to other medications. If your child has had depression or anxiety and you've put them on an antidepressant type medication, and either when they were coming up on the medication or when they were lowering it, they had mood instability where they were more irritable or agitated or disinhibited, I would not readily accept a bipolar diagnosis until you had withdrawn them from that medication and waited a few months to see where their mood is. Very, very frequently, children have adverse behavioral reactions to antidepressant medications, and you want to make sure you don't miss that. There's actually a lot of other medical drugs that can cause things that look like bipolar disorder. Now, I'm talking about steroids. I'm talking about drugs like Montelukast or Singulair. These are, asthma drugs. There's also drugs like isotretinoin that can cause mood instability. This is Accutane. You want to make sure that your kid is not on any other drugs that can have psychiatric side effects, because if they are, you risk giving them the wrong diagnosis. Also stimulants as well. If your child is taking an ADHD medication like atomoxetine or Adderall or Ritalin, very widely known that these things can cause irritability, disinhibitions, things that kind of get more lumped in with that agitated mixed bipolar disorder type picture. The other things that you want to look at with bipolar disorder, in young kids who get this diagnosis are things like trauma, prior traumatic experiences and PTSD, especially if the child is really suffering from it. It can cause a lot of very kind of irritable and depressive type behavior. And in its extreme forms can also look like a bipolar disorder. So you want to be careful that you're not missing any trauma in children. Another thing for the older kids that you want to keep an eye out for are things like drug use. Coming off and on recreational drugs can cause a lot of problems. And so you just want to make sure that that's not another thing that is influencing their mood. Although this is more common for depression, Sometimes dietary changes can cause mood instability. If your kid has been diagnosed with bipolar disorder, and if they're having a lot of gastrointestinal problems like diarrhea, constipation, or if they're having kind of rashes and more signs of an overactive immune system, you may consider an elimination diet or dietary modification, because sometimes that improves someone's mood to the point where they're not having irritability. So all in all, does your child have bipolar disorder? You're really not going to know until you've really ruled out a lot of these other modifiable causes for the bipolar disorder. If they're still having a lot of mood instability, and if it's looking like more of this classic euphoric type picture, there is a chance that they're having an early presentation of bipolar disorder. But you would be right to make sure you rule everything else out first before you simply accept that, because the risks of the medications, they are very real, and it's no small thing to put your child on a bipolar medication.